Hey guys, quick video here, Dr. Rosie Main. I want to show you a little bit about the sciatic nerve, and I think that a lot of times people have questions at my office as far as what they can do help with the sciatic issues. And we first want to talk about what is the sciatic problems that a lot of times it can be coming from, of course, what we talk about, which is the spine. And so just showing you a picture here, if you can see this. So here, your lumbar spine, L1 through 5, you can see the nerve roots that exit, and these nerves here make up what's called the sciatic nerve. You have the front part, and then you also have the back part. The front part goes towards the front of the leg, and the back part, as you can see here, behind the sacrum, you have these roots that go down into these inferior or below the glute. These nerves that go in between these little muscles here that sometimes get really tight. Now, these muscles called not only your piriformis, but also your external rotators of your hip. When they get tight, they pinch off the nerve. So the sciatic pain can also not only stem from your low back, but from tight musculature here, pinching off the nerve right where they compress here. And then that causes the leg to fall asleep and many issues like that. So what we do with chiropractic is we want to first align the spine, make sure there's no interference that's going to cause these muscles to tighten up. So this is a secondary issue stemming from low back subluxation. So we always deal with that first, and then we show you what to do to strengthen, and also first to, the reason these muscles get tight is because they're weak. So we want to strengthen them, but first we want to release some of that musculature. So I'm going to show you 2 little exercises that you can do, or stretches that you can do to start releasing that fascia in there. And so my video is going to be my videographer, and he's going to show me demonstrating what you can do for yourself. And go ahead and follow me this way towards Cruise. And so we're going to use this ball here called a Supernova, but you don't have to invest in such a spendy ball. You can just use a softball. But what you do with this is you're going to place this below those muscles. And like we said, right deep in there, you have you can put your knee in this way, so it could be tucked away, and then you put that ball right in that area of the piriformis, and you can we'll find that knot, and then you can just glide back and forth in that knot for about 2 or 3 minutes. You don't want to do too much at one time. And then once you're finished with that, you can continue to stretch out that piriformis by bringing your chest towards your knee here, stretching that out. Another way, if you can't get in this fashion because if you have knee issues, you can then lay back on your back and bring that same leg that bothers you. You bring the ball right underneath that gluteal muscle, and right in there, you're gonna lean your body towards the opposite side, and then you're gonna glide on that area that hurts or where you feel those tight muscles. So you'll feel a good stretch there, and it's going to be a little painful because you're trying to break up the adhesions. And then the next one that you can do is, again, a stretch towards your chest this way, stretching their piriformis right there. So again, a lot of these you want to do daily, a little bit at a time. And then to strengthen those muscles and the low back, you also can do pelvic tilts. Pelvic tilts basically strengthen the lower abdomen, but also flatten out the back to open up, and just like wobbling with the chiropractic things that you do. Then to strengthen, you can do bridges and squeeze your glutes, and that strengthens the lower abs, but also the glutes there. And then to focus on one side that's weak, you can just bring one leg up, and then you're strengthening that lower glute right there. So that's the beginning, and then later on we can talk about lunges or squats and stuff like that. But the most important thing first is get adjusted. Number 2, so you correct the subluxations. Number 2, you stretch those muscles that are tight. And then lastly, of course, strengthen the weaknesses. And so that's not only going to relieve the pressure, but it's going to correct the cause, which is the main thing. And then also understanding that those same nerves go and innervate the lower organs, such as your rectum, your intestinal organs, such as your bladder, and your sexual organs. So those are very vital areas that you don't want to just ignore. So if you have any questions, post them here. We can always have you make a consultation to come get your spine checked as well. And hopefully my son did a great job with this. So give him lots of hearts here and lots of likes, like this page, and share. Thank you. Bye-bye. All right, and then you finish.